Hi, I'm Dr. Jeff Banas, and I'm going to talk about chronic pain. More importantly, how you could get relief from chronic pain, even though other therapies may have failed in the past, and how you can recover from injuries faster. But in order to talk about how you can recover from chronic pain and how you can recover from injuries faster, we need to talk a little bit about how you get injured or where pain comes from. So bear with me because this will make sense as I go over this and then actually talk about how we can help you with your injury or pain when other clinics maybe have it. So you basically get injured three ways: either an acute injury, a repetitive injury, or a constant pressure tension on a joint, on a muscle, on a tendon. So acute injury, you're in a car and you get rear-ended, or you're running, you sprain an ankle. That's going to lead to a little tear or crush injury. That leads to inflammation. The inflammation then leads to adhesions. Just like if you cut yourself in the skin, fibrous tissue is going to develop over that injured tendon or that injured muscle, and that is going to lead that muscle to be weakness or tightness, and that's going to end up to be more friction and pressure on the muscle or the joint because the tendon is tight, the muscle is tight, it's not inflammation, it's inflamed. And then that cycles around to, decreased circulation. So now you have decreased circulation because it's all tense and tight and weak. You got the inflammation, and so you just keep cycling around in here. The repetitive injury actually just kind of jumps up here. It causes a repetitive injury, so a chronic carpal tunnel or tendonitis in your elbow from tennis or whatsoever. So what we have here is we got this basically cumulative injury cycle that keeps going around. And here's the problem. A lot of the therapies are only addressing a piece of this. They're not breaking this cycle up. So when you get injured or you have chronic pain, what's the problem? Problem is you're going to say, who do I need to go see? Okay, do I see a physical therapist? Should I see a massage therapist? Should I try acupuncture? Should I go see my family doctor? Should I see my orthopedic doctor? Should I go to a pain clinic? Should I see a chiropractor? Should I go see a chiropractor that specializes in sports injuries? So where do you go? So let's say if we go back. So here's what the problem is. Okay, let's just say you get rear-ended. Okay, and you're having neck pain. Okay, so your neck pain is due to neck pain. You had repetitive injury, crush or tear the joints in the neck, and you injured the muscles. Now you got the inflammation in the neck because of the muscles. Scar tissue is into the muscles now because of the fiber tissue laying down. And now that gets weak, and now you're suffering your chronic pain. Well, first of all, just medication alone, what's that going to do? Is that going to affect any of this pain cycle? No. Okay, it might help a little pain, but it's not going to fix anything. So if we go up to here now, let's say, okay, I'm going to go see a physical therapist or a massage therapist. Well, what are they going to do? They might work over on this weak area right here, but you still got this inflammation, you still got that adhesions. So what we typically see when people are suffering from chronic pain or injuries, so maybe they go see a physical therapist and it helps a little bit, okay? But they don't get enough relief. So then they say, okay, well, I'm going to try acupuncture. Well, let's say the acupuncture helps a little bit, but not enough. So they stop seeing acupuncture and they go see a chiropractor. And the chiropractor is adjusting their neck and it's helping a little bit, but they still have tightness. So what we see is a lot of people kind of just jump around from one therapist to another therapist. Well, we got the solution for that. Okay, the key to recovering faster and the key to recovering from chronic injuries is combining multiple therapies together at the same time. So let's talk about someone who's had chronic neck pain or let's say chronic back pain, same thing. Well, if they just go to a massage therapist, they're just going to get muscle work. A lot of times if they just go to a chiropractor, they're just going to go get manipulation and mobilization done. If they go to physical therapy, maybe they'll just get some type of exercise done. Well, what we've done is we've combined multiple therapies together at the same time. So that person now might be coming to see us for the chronic headaches or neck pain, and we are going to mobilize the joint. We are going to do deep tissue to break up that fibrous tissue. We may add trigger point injections or some type of dry needling that will also help break up that chronic pain in that trigger point. We might do some deep muscle stimulation, some cold laser. There's nutritional points that you can work through your diet, and there's nutritional supplements that can help with chronic pain. There's topical muscle support. There's medications that you can put on the muscles to help with the pain. And then there's stuff like topical magnesium that you put in the joints, which is like a concentrated Epsom salt bath. We do weight loss. If you got chronic back pain, do you think dropping 20, 30, 40, 50 pounds will help? Well, of course. Well, if we help you drop, 40 pounds of the weight, mobilize the joint, deep tissue in the back, maybe trigger point or needle injections on the trigger points, deep muscle stem, and I'd even put in here strength and conditioning, well, that's why we get much better results. So the solution is, what we've done is combine multiple healthcare providers working together as a team. We have sports chiropractic, physiotherapy, strength and conditioning, trigger point and injection therapy, pain management, medical physicians, weight loss doctors. We've combined them all under one clinic. So if you're having some of these chronic pains, give us a call, and we'd be happy to take a look at you. I'm Dr. Jeff Banas, and we do pain management, sports injuries, physiotherapy, weight loss, metabolic testing, natural hormone therapy, weight loss, and fitness coaching.